So I thought I'd take just a minute and talk about hypersensitivity reactions. I used to have all these in a nice little chart gridded, and I can't find my chart or I'd share it with you. But let's talk about them. So several people have asked about hypersensitivity reactions, and I thought it was best just to review all of them with you and answer questions that way. You'll find when I ask you a question, I'm probably going to give you a little extra information. So there you go. Type 1 is allergic reactions. They're common, they're caused by allergens. You will see skin rashes, hay fever. We'll talk about those things, all the different things you'll see. The causative mechanisms listed for you there, exposure to the allergen. And then the development of IgEs, what the mast cells do come into play. We'll talk about those maybe in a minute. The most common, the most serious, I guess I should say, complication would have to be anaphylaxis. So with hay fever, this is essentially that allergic rhinitis, the sniffy, stuffy, sneezy, runny nose allergy that you see. The nasal mucosa is affected there. Food allergies, the digestive tract mucosa is what's going to be reacting and hypersensitive. Atopic dermatitis or eczema, you've got skin then that is reacting. And finally, asthma, where the bronchial mucosa is reacting. It reacts by vasoconstricting, by making increased mucus, just like all the rest of them here. And it also has inflammation and swelling. What else? I didn't change pages. Sorry. So, from your book, here's a nice little diagram that shows what happens. I'm not going to go into detail on that. But you can see that the end result of all of these things, and I need my reading glasses, are inflammation, edema, redness, and pruritus, it looks like. So, anaphylaxis was the most serious complication. Anaphylactic shock is life-threatening. It is a systemic wide. It's not just your nose. It's not just your GI. It's systemic hypersensitivity reaction. It is body-wide. Decreased blood pressure, and that's caused by release of the histamine. There's airway obstruction because of the swelling, the inflammation, severe hypoxia. What can cause anaphylaxis? Anything that you're allergic to. Insect stings, latex, rubber gloves, nuts, shellfish, tree nuts, all kinds of things. Signs and symptoms. Generalized itching or tingling, especially in the oral cavity. And then comes coughing, difficulty breathing. With difficulty breathing, you know that there's limited oxygen getting there. So the weakness, dizziness, fainting, all of those things come into play. Panic, fear, puffing, hands, eyes, lips, tongue, hands, feet, all of it. Hives will form. And then with all of those things, without intervention, loss of consciousness and even death. My experience with anaphylaxis has been waking up in the middle of the night after taking a drug for my stomach, omeprazole, I believe. I never say that right. My palms were itching. I woke up with my palms itching and I scratched them. And they became more and more and more severe itching. I couldn't stop scratching. And then I suddenly realized I was getting hives. I was watching before me a hive just popping out of my skin. Then I started coughing. Then I realized I wasn't getting air and I was coughing because of my windpipe. And fortunately, I don't have an EpiPen prescribed, but I do have a nebulizer. And I was able to do albuterol and get my airway going and get things calmed down and take Benadryl and survive it. But it's exactly like it says here. The itching, the tingling, coughing, difficulty breathing, and you've got to do something pretty quick. Another diagram of the anaphylaxis and what goes on with your skin Cardiovascular, sorry, I'm yawning again. Lungs, everything is shown here. It's a pretty good diagram. Here are the signs and symptoms of anaphylaxis. You know how I tell you to look at the tables and charts and things? Well, here you go. The skin, the respirations, the cardiovascular, the CNS, everything that's affected, and why, the rationale. What do you do for treating? First aid response. If there's an EpiPen, do it. Call 911. Get oxygen, but if you're swollen shut, oxygen's not going anywhere, right? So you've got to get epi somewhere on board. In the emergency department, that's what you're going to get. Epinephrine, you're going to get glucocorticoids, antihistamines, oxygen, and get the blood pressure stable and your whole body stable. Okay, type 2 hypersensitivity reactions. Cytotoxic hypersensitivity. The antigen is present on the cell membrane. It may be normal body component or exogenous. The circulating IgGs react with the antigen, and there's destruction by phagocytosis or cytolytic enzymes. An example of this is an incompatible blood transfusion, where things are destroyed by phagocytosis. A type 2 hypersensitivity you can see here, and you can see phagocytosis at the bottom there. It's a fascinating function of the cells. But I digress. Type 3, immune complex hypersensitivity, where the antigen combines with an antibody and form an immune complex deposited in the tissue and activates the complement system. Inflammation and tissue destruction is the result. Glomerulonephritis is one of the examples of this, and you have talked about acute post-strep glomerulonephritis in class. I just made slides about that, actually. So there you go. Rheumatoid arthritis is another example of type 3 hypersensitivity reaction. Here is a diagram from your book about a type 3 where you can see the antigens and the antibody. The antibody binds to the antigen. The immune complex forms, you see there in the circulation. And with that, the complexes get deposited in the blood vessels or in the tissues. The complement is activated, and then the inflammatory response, wherever that complex was deposited. Lysosomal enzymes and chemical mediators are released. And ultimately, there's tissue damage, as you see at the end there. Type 4, cell-mediated or delayed hypersensitivity. Cell-mediated or delayed. This is a delayed response by the sensitized T lymphocytes. The release of lymphokines. It's an inflammatory response, destruction then of the antigens. Examples of this include the TB skin test, contact dermatitis, and allergic skin rashes. Poison ivy comes to mind. Okay, so I am stopping there with these slides and this information. I just wanted to do that little bit for you to make sure we went through those. And I believe that's all I have.